So at the ASCO meeting, I'll be discussing an important topic: how to sequence novel agents in the management of chronic lymphocytic leukemia. Over the last 4 to 5 years, it's been a really important time for patients with CLL. We've had several new molecules that have been approved, including ibrutinib, idelalisib, venetoclax, and obinutuzumab. And as we have more agents becoming available, one of the bigger questions is, how do we sequence these agents? Well, when we look to the literature, sequencing has not really been a topic that's been intensively studied in CLL. Clinical trials often have comparators which are not always the clinically relevant comparator. When patients are censored on clinical trials, we never have long-term follow-up, and most of the data that we have on sequencing actually comes from retrospective comparisons or registries. And so the task of this presentation was to put together the information that we have from clinical trials, put together the information we have from retrospective studies and registries, and try to come up with a sequence or a schema that allows us to think about how to choose these agents for patients, in what order, and how to think about next choices based on prognostic profiles, performance status, reasons for discontinuation, for example. And so that'll be the focus of the presentation, and what we've tried to do is put together a schema thinking about patients who are treated with chemotherapy versus novel agents, thinking about patients based on their IGVH status, think about patients based on their P53 status, and not only think about what's the appropriate frontline therapy, for example, but think about, once you've made that decision, how does it carry on to their second and third line of therapy, but also to point out what the gaps are in the literature and where clinical trials needs to go and where real-world evidence needs to go for future studies to try to answer those questions.